Today we are going to discuss about Fruncle. It is a staphylococcal infection of hair follicle. Let's see. This is hair. Here is hair follicle. In Fruncles, there is an infection of hair follicle here. And sometimes this infection leads to an abscess formation. As hair is only confined in the cartilaginous portion of ear canal, therefore Fruncles are only present in cartilaginous portion of ear canal. Fruncles are seen in cartilaginous portion of ear canal. Due to this reason, it is also called localized acute otitis externa. This is the second name of Fruncle because the Fruncles is only associated in the cartilaginous portion of ear canal. Now we will discuss the clinical features. In Fruncles, there is extreme pain This pain is out of proportion to the size of Fruncle, means that Fruncle will be short in size but the patient will complain of extreme pain. Jaw movements are painful in Fruncles. Ear movements are also painful. In Fruncles, there is also tenderness of ear. When a Fruncle occurs on the posterior meatal wall, then it will cause oedema over mastoid process, and there will be obliteration of post-auricular groove. Now we will discuss the treatment of Fruncles. As there is pain, we will give analgesics to relieve the pain. We will give antibiotics because Fruncle is due to Staphylococcus aureus infection and Staphylococcus is a bacteria. We will also apply heat fomentation. %10 ictamol glycerine is also applied. This mixture, ictamol glycerine, is composed of two portions. One is glycerine and one is ictamol. This glycerine is a hygroscopic agent. What is meant by hygroscopic agent? Means that this agent will absorb the water, due to which it will reduce its edema. and this ectomole part is only antiseptic. It will only destroy the germs. But if the abscess is formed, as I have told you, that when there is infection of hair follicles by Staph aureus, sometimes an abscess is formed, then you will do the incision and drainage. Incision and drainage in case of abscess formation. Now, if this disease reoccurs and there is recurrent infection of Fruncles, then you will have to exclude the diabetes in the patient. If the patient is diabetic, then you have to treat the diabetes also. And there is an also important point that Staphylococcus bacteria is present in the nasal vestibules of a person. So we will pay attention to the nasal vestibules in case of recurrent Fruncles. It is also possible that the Staphylococcus is transferred from the nose to ear by the hand movements of the patient.